Most of us have a hard enough time dealing with the sweltering summer heat, but it is even harder for pregnant women.
You know, spending too much time in the hot sun can put you and your unborn child at risk. Channel 3 meteorologist Nick Austin spoke with an expecting mom and a local doctor about how to stay safe.
The rules for pregnant women aren't much different than for the rest of us, except they're following the rules for two. Holly McMillan is 40 weeks pregnant, expecting her baby girl to be born any minute. Her daily walks have been tougher since summer began.
Yeah, you definitely sweat a little more than normal. The extra weight that you're carrying, you tend to be a little bit more aware of when it's 90 degrees outside versus 70 degrees outside.
She can go a few miles if it's early in the day, but McMillan listens to her body and knows when to call it quits.
If I'm walking, I can usually tell that I'm getting a little bit more winded, and I'll check my heart rate on my fitness tracker.
She also uses an app to keep track of her water intake. McMillan's doctor, Kirk Brody, says hyperthermia, especially in early pregnancy, can increase the risk of birth defects.
They're hot in the middle of winter, much less when it's 90 or 100 degrees outside. So it's real important that they find some shade if they possibly can. I try and tell my pregnant ladies if there's things you have to do outside, try and do in the early morning or the late evening.
Overheating can cause dizziness and falls. This could harm the baby. Brody says to keep your core body temperature at less than 103 degrees and drink plenty of water throughout the day.
If you're not having to urinate as a pregnant lady, at least every couple of hours, you're not drinking enough. If the urine's getting really strong or really yellow, again, you're not drinking enough.
Dehydration also makes the brain produce a hormone called vasopressin, which is similar to a hormone involved in stimulating contractions.
But you'll get these annoying contractions that will force you to call your doctor or go to the office or go to the hospital sometimes, only to find out you're not really in labor.
Dr. Brody says that pregnant women should not use saunas. Hot tubs are safe if the water temperature doesn't get warmer than 100 degrees, and limit your dip to 10 minutes. Also, apply and reapply sunscreen often while outdoors. In the studio, I'm meteorologist Nick Austin, Channel 3 Eyewitness News.